This is the 1 Million Lives podcast by Laerdal. Listen to healthcare professionals, healthcare educators, and survivors share their best practices and what they've learned from these experiences. At Laerdal, it's our goal to help save 1 million more lives every year by 2030. One life at a time.
In our search for new themes to cover here at the 1 Million Lives podcast, we came across the Pediatric Simulation Training and Research Society of India, or PediSTARs for short. We found out that this society aimed to promote the use of simulation by conducting various conferences in different parts of this vast country, India. One of the key persons behind the society is the former president of PediSTARs, Dr. Vijayanand Jamalpuri, who is a consultant neonatologist at the Rainbow Children's Hospital in Hyderabad in central India. He has also spent some time training and working in UK and in New Zealand. Dr. Vinay Jamalpuri is joining us today from the Rainbow Children's Hospital in Hyderabad, and if you listen carefully, sometimes you will even be able to hear the sound of small children in the background. For those of you who do not know exactly where Hyderabad is, let's put it on the map. Make a line from the southern peak of the country in the center and straight north. Hyderabad is around 1/3 on that line from the southern peak. But we also found out that Dr. Vinay Nadkarni, Medical Director of the Center of Simulation and Advanced Education and Innovation at the Children's Hospital of Philadelphia, a well-known person within the international pediatric simulation circles, has been involved as one of the global consultants and advisors for the PediSTARs Society. We were lucky enough to get hold of both for a joint recording, and for the first time, we have two guests on the 1 Million Live podcast. So in addition to Dr. Vijayanand Jamalpuri sitting in Hyderabad, we have also Dr. Vinay Nadkarni sitting in his hotel room in Panama, where he is to attend a conference. But over to you first, Dr. Vinay Jamalpuri. How did it all start?
Yeah, the story started in 2013, August. Three simulation enthusiasts who trained in the West, Dr. Geetanjali Ramachandra, Dr. Sujata Tyagarajan, and Dr. Rakshesh Shetty. So they wanted do something different to make the change to the outcomes of the patient we look after. Three of them has got pediatric critical care background. They all they had experience of using simulation abroad, and they realize how much it can change the patient outcome, how better you can work when you use the simulation as a tool. And they came up in 2013 and started the Pediatric Simulation and Training Society, which is PediSTARs, with the great support from the international mentors across the globe. From North America, you have Vinay Nadkarni with us now, and we have mentors from Europe and also New Zealand and Australia. And within no time after their intention, the PediSTAR started implementing what they wanted to do in 2013. Interesting, so 2013 they started, but 2014 they started actually involving the international people. And the very day when I was relocated from New Zealand to India, and then I joined the PediSTAR.
What was the original purpose of starting up PediSTAR? And what did you try or hope to achieve?
Well, ultimately, what we believe and what our vision is to make the difference to the patient outcomes, the little kids and babies, for that matter, any patient across India, through better management, learning through simulation, not just for training and education, beyond that, making the system changes, making people aware how to practice on variety of things, wherever the simulation can be used as a tool, the ultimate purpose, you make the difference about the patient outcomes.
Was this mainly for students, or was it also for residents and other personnel already working in the hospitals?
Excellent question. It's for everybody. So it's not just a training tool. In fact, the initial sessions for PediSTAR were actually qualified doctors and nurses. And because they are already for doing their work in healthcare, and they realize that the learning is continuous. And we also made people to realize, well, the moment we say simulation, the people relate to a procedural skill training like BLS, ALS, and here the PediSTAR spread the message across India. Look, simulation is beyond that. As I always remember, my mentor and my international advisor, Dr. Vinay Nadkarni, is a famous slide where he showed the hierarchy of what is the purpose. The purpose is to make the difference to the patients. And that's where we said, look, yes, and when we initially started, there were a lot of barriers, there are a lot of hurdles and obstacles. One of the question being asked, why we need simulation? We have so many patients to practice. Well, the question we pose them, well, are we doing the right thing to all these patients? Are we doing enough what we should be doing? The answer is no. So simulation has got value and a role to play no matter across the globe, wherever you are. So that's how, and the same people who asked the question accepted the simulation, started the simulation, and their buzzword today is simulation for better outcomes.
Yeah, let me just add something to that. I think what we see whenever there's a startup of an advanced technology, in this case, simulators, there's an attraction of the doctors. And oftentimes, the focus initially is on the doctors, especially in low middle income countries. And then it filters downward and reaches medical students next, then finally the nurses and ancillary staff, etc. But oftentimes it's some glitz, it's some technology, it's something that's happening, a movement that's happening in Europe or the US or elsewhere, Australia, and then it catches fire. And what I think happened here was that the very advanced education doctors were stimulated and began with the doctors, the practicing doctors, academic doctors. And then it started to catch on. And one of the things that had to be unlearned or myth busted, if you will, Bjorn, was that these were skilled trainers, that the value of simulation was skilled training. It's so much bigger than that. And this realization came to life mainly because low-cost simulation-based education had to evolve. The aspiration was for high-end, high-tech simulators, but the impact came from low-cost simulation and debriefing.
How did you get involved in this project?
It's a long story, but to make the story short, I, on one of my visits to a conference in India, a medical conference for intensive care, I encountered the three individuals that Vijay mentioned, and they were trying to put together a pre-conference workshop that would involve simulation. Laerdal helped them with some setup, and they were struggling so much to communicate because of the focus on high tech simulation. And we sat in a room and we discussed what is the purpose of this workshop. It's to learn the content, the skills, the behaviors, the attitudes, and the teamwork that go into caring for the patients. These dedicated individuals completely revamped the workshop in a matter of hours and reconfigured it to achieve those goals and persisted. This was so inspiring that we called our friends in other countries, Michael Shepard, Peter Weinstock, to name a few, who were experts in simulation, and they volunteered to come over on their own, at their own cost, to continue the process of both inspiring and being inspired by these dedicated individuals in India.
Dr. Vijay Jamalpuri, I understand that the PediSTAR's community has also been engaged in some research projects. Can you say a bit more about that, please?
The majority of research, I would say, what we did through PediSTAR so far is developing the tools, designing the workshop, and what we need to improve upon is to show that these simulation work is a making difference to the patients. Having said that, there are people who've been trained with the PediSTARs, including me. We have demonstrated that simple simulation based education and training tools do make the patient difference. For example, our own study from Rainbow Children's Hospital, we did a simple simulation based quality improvement initiative to prevent extravasational injuries in small babies, and we presented last year at International Pediatric Simulation Conference. Actually, we got the best oral presentation for that. So, and similarly, we have SSH Presidential Award for sepsis simulathon we did, and again showing that we can make the difference to the patient outcomes for the simulation based training and system testing tools. And again, one of the important things we did, the sepsis award we got for the what we call is simulathon is a period prevalence simulation activity across India same time, so that we send all the material needed for the simulation enthusiasts, where they conduct the simulation and share the learning what happened. So this sort of, you can say, sort of a learning from others, learning from your own unit, and it did make the difference.
Do you get any recognition of what you do from the medical communities in India or from the government?
Well, that's a very good question. And what I say is, well, we did get the recognition through the medical fraternity. But actually, to start with, people have questioned our motives and also our intentions. Initially, they thought that we are trying to sell some high technology, high cost mannequins. But the people later realized that we are here to educate people how to use a low cost models and to make the difference to the patient outcomes. And in fact, all these simulation enthusiasts, actually they spend money from their pocket, a significant money as well. So later on they realized, yes, but the government recognition, yes, it is patchy. And what is the important thing I would say is, we have a very premium national institutes of medical education, and those institutes have recognized the PediSTARs. In fact, the majority of annual simulation conferences were being conducted by them, where we also have done faculty development program. It's geared up everywhere now, and all these institutes want to embrace simulation and want us to help them. We feel that there's a recognition for us as a PediSTAR, but ultimately the motive, the purpose is always the bigger goal, which is making the difference to the patient outcomes.
You're listening to 1 Million Lives, a Laerdal podcast.
When you ask about research, there are two things. One, simulation, as you know, can be used as a methodology of education, or it can be used kind of as a systems evaluation and intervention. So as a tool to evaluate. And so what Vijay was describing about these simulathons, these are national weeks. So essentially during simulation week, they put out a simulation scenario to be conducted in hundreds of hospitals across the country, say a trauma case or a sepsis case or a case of violence against the healthcare provider. And they run the exact same simulation across the country in different environments. And they collect through social media and WhatsApp the challenges, the facilitation, the things that are occurring, the problems they identify, system, individual, team, etc. They report these, and then they bring that to their national conference, and they hold what they call an Inspire workshop, the international network of simulation-based innovation and research and education. And they hold workshops on asking young investigators in the country to develop an alert presentation, a very quick idea, a hypothesis to bring to this group that's interested in changing a clinical challenge into a research project where they can actually demonstrate a difference. So initially only 5 or 6 came, then 10 or 20, and now there are more than 50 who come and present their ideas to this group. And then the, quote, experts, the experienced researchers in simulation-based education can advise. They're matched up with each of these young investigators to take their project home and work on that project, report back, and the next year they bring back the results and they discuss them. This stimulation is a combination of a systematic approach and an individual approach. What we know in India is that individuals working with individuals, encouraging, supporting, critiquing, makes the difference. It's not, the society has to be there, the infrastructure has to be there, but people helping people seems to be, what makes the difference.
I just want to add something to what Vinay said. And these Inspire meeting, first time from India, there was nursing representation to nursing colleagues coming to say that this is a research work, we want to do it, and that is being very highly appreciated. And it is being under the way at the moment, is being conducted at the moment, and then it spread like a wildfire to all the nursing community across India. And now more and more nursing healthcare professionals are joining PediSTARs to buy this idea of using simulation as a research tool for the patient outcomes.
Dr. Nadkarni, this is quite a setup. You have in many ways your finger on the pulse on what is happening around the world when it comes to pediatric simulation. How unique is PediSTARs? Is there something similar happening elsewhere in the world?
I would have to say, Bjorn, my impression is that PediSTARs has led the way. I'm not aware of another group that has been as enthusiastic, as successful, or encountered as many problems as PediSTARs has. But I would say that it is spreading. So, for instance, PediSTARs inspired boot camps, simulation-based boot camps, and mentored Pakistan, their mortal enemy in war. But they crossed the border with simulation-based education, and people helping people were able to bridge and remotely support Pakistan to start to develop the same system in Pakistan. The learnings from what Ebor Jacob James, the current president of PediSTARs, has done at his home institution in CMC Vellore is now being spread to Kumasi, Ghana. They're sharing their knowledge and their inspiration to countries in Africa, other countries in Asia, and actually inspiring many of us in the United States to do better and to do more. There are so many good projects going on worldwide. This is not to ignore all the great work in Latin America, so many different places that are doing high-level simulation, formal simulation-based education. But what I'm impressed about with PediSTARs is how, in a very inexpensive and social media type methodology, they've been able to leapfrog to the front of simulation-based education. I will say that the Society for Simulation in Healthcare, the IMSH, has been very helpful in giving a legitimacy. They recognized PediSTARs. This legitimacy really helped PediSTARs grow in the country, because in many low and middle income countries, there's a necessity for a certificate for an organizing body that's recognized internationally to give authorization or certification. These are not to be ignored. So you need both the grassroots and you need the large simulation societies to endorse, if you will. Many of the institutions that are recognized internationally, University of Pennsylvania, Boston Children's Hospital, the Starship Children's Hospital in New Zealand, these are, quote, name institutions. They give legitimacy, even whether they should or not, we can debate. But they do give some legitimacy to the upstart of such programs, which gives it a boost and an attraction for the international participants.
I totally agree with Dr. Vinay Nadkarni about all these international societies helping and giving the legitimacy to the institutes and the programs like PediSTARs. And I have to say, IPSS, International Pediatric Simulation Society, and SSH, Society for Simulation in Healthcare, has helped PediSTARs tremendously. All our international mentors are from IPSS, and they literally handhold us to do this journey. Any minute, any time, they are there for us. So thank you, Vinay, and you and your entire team. And we were people who were not even aware about simulation research. So we've been introduced to another body which is Inspire, you might have heard, and also help us to take the simulation research to the next level in India.
I think the challenge is in the United States, we have a saying, we're going from a mom and pop shop. That's a small business that's run by a mother and a father and very local. And there's a lot of involvement, investment, and control. And it's very, very small. And you can get a lot of things done because you know the mother and the father and they can do what they want. And as it becomes a system, as it becomes larger, the benefits are it becomes sustainable, it becomes systematic, it doesn't depend on the work of one or two or three people. But the downside is it becomes big and it's policy and procedures and it has to evolve to have a system. And PediSTARs is in this transition phase now, I think. And the sustainment, how do you keep the inspiration of the individuals and the life ability to move this direction and that, yet become a system that is sustainable and supportable. And they're figuring this out. They're moving from being the doers, where the few people have to do all the work, to training the trainers, to training the facilitators, and to letting the ripple effect, as Vijay was discussing, roll out and bubble up. And this is the excitement of now. But the people who were initially invested sometimes become bored. They are pioneers, right? And now the new adopters have taken over. And then for sustainment, it's a different group that become very interested in this. So as in all businesses, as in all enterprises, they're in the transition trying to figure out how to best utilize all of the individuals involved. And we also have to recognize that the methodology that worked in India or is working sometimes in India is not cookie cutter. It's not possible to just take what worked in India and translate it to Africa, to Latin America, to other places. The concepts will translate, but the contextualization of how to get it done and how it should evolve has to be, in my opinion, individualized and taken on by the people in the trenches because they know how things work. And some of our mistakes in the past have been to try to take something that works in one environment and simply replicate it in other environments. And even in India, with the diversity of language, diversity of culture, diversity of people and customs, we have seen that one size doesn't fit all. It is very important to rediscover in each region what works, what's needed, and how to get there.
Dr. Vijay Jamalpuri, where do you see PediSTARs 5 years from now?
I think this is the 10th anniversary of PediSTARs. So if you look back in 10 years, what did PediSTAR achieve? Where were we? Where are we today? And where we want to be tomorrow? So in that perspective, when we first started this journey and people were dismissive about value of simulation based education and methodology, because we have such a volume of patients over in India. But now everybody recognizes, realizes the importance. So we have done the job of sensitizing. And now everybody agrees to the extent that National Medical Council as well as National Nursing Council has drafted guidelines to incorporate simulation as a part of learning tool. And so that's where we are. So a job done to disseminate the information of importance of simulation. And the second thing what we did, we showed them how this can be done, how this learning can happen in variety of specialty areas, let it be pediatrics, neonatology, or acute care, critical care, and so on. So we have shown them, demonstrated what are the models, how we can take it forward. And another important key thing what PediSTAR has done is, and to what PediSTAR has done is producing these sim educators or facilitators, not only India and also in the surrounding countries like Sri Lanka. And so these sim educators, in favorite word of Dr. Vinay Nadkarni, the multiplication factor. So what we want to do is all these sim educators or sim facilitators, whatever you call, want us to further take it forward to make that everywhere across the India that there should not be any deficiency of such facilitators where they take the simulation based learning and or simulation methodology for patient improvement should become a routine. So that's one thing we want to achieve in the next 5 years. The second thing I would say, our focus on research in simulation has to get up. So we started, and in the most recent Inspire meeting, there were quite a few number of alert presentations. You don't believe there were nursing staff from India. They were presenting on an international platform of simulation research. So, but one of the important aspects, what PediSTARs, again, our mentors encourage us to do that, to link the simulation research with the patient outcomes, to tell the world that simulation is key to make the difference for the outcomes. Not just in the sim lab, not just in the participants' confidence level or reporting back, it's actually make the difference in the real life. That's what we want to focus on. The second. The third and the most important one is, as we already discussed, that one of the important thing is we want to be infectious in the surrounding areas, spread this enthusiasm of promoting simulation in the neighboring or the similar low or limited resource countries like Bangladesh, Sri Lanka, maybe South Africa already. And we did one important thing in this 10th anniversary. Our team, PediSTAR team, went to Sri Lanka, did a faculty development program stage 1. And similarly, we are also talking to people in South Africa to collaborate. And because our needs are more or less similar, we made some journey in the limited resources. The same, some colleagues from Pakistan, they have been talking to us, and we also did a virtual boot camp with them last year. And so we want to be one of the key partners in promoting simulation-based learning in at least in the similar countries, and then not necessarily neighboring countries, but eventually we want to become a true global partner in taking simulation forward for the purpose of making the difference to the sick children and the adults we look after, no matter wherever they are across the globe.
I would like to thank Dr. Vijayanand Jamalpuri at the Rainbow Children's Hospital in Hyderabad in central India and Dr. Vinay Nadkarni from the Center for Simulation and Advanced Education and Innovation at the Children's Hospital of Philadelphia, who during this recording was joining us from his hotel room in Panama.
You have been listening to a 1 Million Lives podcast by Laerdal. You can find all our podcasts and access any bonus material on laerdal.com/podcast. The views, information, or opinions expressed are those of the guests and do not necessarily represent those of the institution they are affiliated with or of Laerdal Medical. If you have any suggestions for guests or topics we should cover, please send us a message on laerdal.com/podcast. We look forward to hearing from you.
Until the next time, goodbye from the Laerdal podcast team.